The resources and contributions continued does rely on not only improving flow maps and the process and detailing the steps in the standardized process, but it entails making sure that the policy is updated, which will require parole agents to enter logistical information consistently at 30 days from parole. Currently, it is a target and it is not an established requirement. So we will be working and collaborating with custody leadership to get that done as well. They do have the capability. It is just a matter of having that conversation and updating the policy for our custody partners. We can also, going on to the next bullet, we can also increase the access to RN, social worker, and outside providers via telecommunication. What that means is making sure that as we discuss the opportunity to place patients in specific programs, that we can definitely have our patients get linked with any pre-screening requirements that the outside providers may have. This will make sure that the outside provider clinic has everything they need to confirm whether or not they can take this patient and secure the appointment before the patient paroles. The other resource contribution is the informatics, establishing the parole release date tracker or live database to facilitate prioritization. So we talked a lot about how patients can go to court and dates for parole can change. In a very controlled environment, such as in a hospital setting or rehabilitative setting, we have a tendency to understand when patients may be discharging very early, and there's normally enough time in those organizations because it is an acute care type of situation. But in this situation, outpatient situation, and a very unique incarcerated population to the community, we do need some type of database to tell us when patients are paroling and when the date changes occur, which keeps our nurses informed daily on having to prioritize patients who initially may have been paroling in 60 days are now paroling in 30 days. So that is very important. We'll be working on updating that and making sure that that is a reliable source for the process. Also, we will work with the Community Transitions Network to discuss timely follow-up within 48 hours for appointment inquiries. We can't be waiting too long. We do need to work with our community providers on specifically the Transitional Care Network to find out if they can work on linking our patients closer to 48 hours, or at least respond within 48 hours, so that it does not create undue stress on having nurses having to follow up a week after. So the timelier the better with any process. Also, we'll develop direct county and city provider links when transition care networks fail. So we do have direct county and city links for these patients. In other words, we have a list of several providers. However, we need to continue on working on establishing more and more providers to make it a lot easier for the nurses and supportive staff who are trying to facilitate these appointments for our patients.